Hi, I'm Brooke Green. I'm a Miles City student nurse, and today I'm going to be demonstrating administering an IV. So first, I'm going to check my orders, and I'm going to make sure that I have the 6 rights. So I have the right patient, the right drug, the right dose, the right time, the right route, and of course my documentation. So the doctor ordered 1,000 milliliters of normal saline infused over 6 hours. So I'm going to make sure that I have my 1,000 milliliters of normal saline, and that matches up. So I'm going to go ahead and prepare my IV. And of course, I'm going to wash my hands. Before I do all this, I'm going to wash my hands and put on gloves. And I'm going to inspect the solution and make sure that it looks clear and that I have the right solution once again, and it looks good. I'm going to get my tubing. I'm going to make sure that I close the tubing so I don't have a big mess. And I'm going to squeeze a dropper until it's halfway full. And then I'm going to prime my tubing to make sure that there is no air left in the tube. My bag up. Okay, now that I have my IV bag and my tube prepped, I'm going to go into the patient's, or I'm going to look at the patient's arm. I'm going to explain what I'm doing. I'm going to make sure that the patient doesn't have any allergies. I'm going to check the armband and have the patient tell me their name and date of birth. So I get 2 forms of identification. And then I'm going to go ahead and get all my stuff open here so that I'm ready when I do find a good vein. I'm using a 20 gauge IV needle. Oh, and I'm going to actually, I forgot to do this, but I'm going to write on the, so that I can put on the IV bag what the patient's name, last name, room number, normal saline, 1,000 milliliters, the start time, the date, and the flow rate, and then my initials. Okay. Let me get my tape ready here. Okay, so now that I have everything that I need, I'm going to go ahead and get my normal saline ready to so that that's ready to apply to the patient's IV when I get it in. So now I'm going to look at the patient and find a vein that I like, a straight vein. And I have one right here. So I'm going to apply the tourniquet. And I'm going to make sure to apply the tourniquet 4 to 6 inches above the IV site. I'm going to first wipe up the vein, make sure that it is all nice and clean and it kind of makes it pop up for me. Then I'm going to take another alcohol wipe and I'm going to start at the place I want to inject, and I'm going to start from the center and work my way out in a circular motion. I'm going to let that dry. Then I'm going to take my 20 gauge IV needle, and I'm going to make sure that the bevel is up, and I'm going to go in at a 10 to 30 degree angle, and with my non-dominant hand I'm going to stabilize the vein by pulling downward. And once I'm in, I'm just going to feed the catheter in and not the needle. Okay. So that seems to be in good. I'm going to wipe this off. I'm going to release the tourniquet now. And I do have blood return, so I know that it's in the vein. Okay, and I'm going to flush the vein with saline. It's going in nice and smooth, so the patient isn't complaining of any pain. It feels good. I'm going to go ahead and remove that. And now I'm going to secure my saline lock. I'm going to go ahead and do a chevron. So that it stays more secure. And then on this, I'm going to write the date and my initials. Okay, everything looks good. I'm making sure that the patient doesn't have any pain, any discomfort, that there's no coolness or swelling at the site or redness, anything going on. Once I make sure everything is okay with the site, I'm going to go ahead and hook up my saline solution. I'm going to go ahead and wipe off the wart there. Okay. And I'm going to go ahead and loop this up so that the patient doesn't have to worry about it dragging or getting caught on anything. Okay, and since this has to be infused over 6 hours, and the tubing, this is a 10, has a 10 drop rate factor. So it figures out to be 28 drops per minute. So I'm going to adjust my flow rate to make sure that it's going to be 28 drops per minute. I'm going to watch the clock. Okay. So that is about 28. Drops per minute. I'm going to make sure that the patient is still feeling okay. Gonna check the site again, and then I'm also gonna come back and reassess the site and make sure the patient is not feeling any discomfort, and make sure that it's still dripping at the right rate. And that is how you